what they're interested in, how much they're sleeping, what they're doing during their day. All of those things are really helpful because parents really are looking for a change. It's normal for kids to have ups and downs. If a kid starts becoming more withdrawn, maybe sleeping more often, more agitated, that's going on for more than a couple weeks, right? That's where we start to get more concerned. So normal to have kind of like a bad day at school and to be tearful about it, right? Different to be tearful every day after school for a couple weeks. That's something we want to be paying close attention to. There is a tendency for kids to do a lot of masking and pretend like everything is going really well because they worry that if they let somebody know about a thought that they're having or persistent way that they're feeling, that the reaction is going to be really big and that's going to be really scary for them. So it is really common to see, that have a kid who seems like they're doing really, really well, right? Later sort of report that they've been feeling anxious or they've been feeling sad for weeks or months and they were struggling to talk about it. So that's where like the little flags, kid is normally a great student and their grades are slipping, and they're like checking in for bed at 8 o'clock every night, or they're, where a parent can kind of like perk up their ears and while keeping their reaction sort of tempered, open a conversation about, what the kid's experience is like. There's not, right? And a lot of the decision making about like how you navigate the demands of school while coping with all of these other stressors and anxiety or depression on top of that, that's really going to be tailored to the individual kid. It's always applicable, like when we talk about depression, anxiety, to bring up 988 and the 988. There's call, text, and chat. It does not need to be a crisis involving suicide in order to use that line. It just needs to be a crisis. So I encourage parents and kids all to like know about that resource and take advantage of it. And then for parents, I guess I would encourage like a big dose of compassion for themselves. It can be very scary and stressful to navigate these things with your kids, and all the things that you would do to try to create some protection or some resilience with your children against bullying, against when you worry about depression or anxiety, against those things. The relationship there is really the most protective element. And what's beautiful about that is that it operates far outside of just those specific threats.